Hello, everyone. This is Amy Hagel, SHINE Liaison and Volunteer Manager at Senior Connection Center. Today, we have Local Coordinator and SHINE Volunteer Carolyn from Manatee County. We know that Medicare is complicated, so we have created this weekly video series that can answer some of the questions that you may be having. In today's topic, we're going to be covering Medigap policy. So hi, Carolyn.
Hi, Amy.
So the first question, let's start with the basics that somebody might be having. What is a Medigap policy?
Well, a Medigap policy is an insurance policy that helps supplement original Medicare and is sold by private companies. A Medigap policy can help pay some of the remaining healthcare costs that original Medicare doesn't pay for covered services and supplies, like co-payments, co-insurance, and deductibles. Original Medicare pays for much, but not all, of the covered healthcare services and supplies. There are gaps in Medicare coverage.
No. So, is there an open enrollment period for Medigap policies?
Well, yes, there is an open enrollment for select Medicare policy guarantees that for 6 months immediately following the effective date of enrolling in your Medicare Part B, a person age 65 or older cannot be denied Medigap insurance or charged higher premiums because of health problems. No matter how a person enrolls in their Medicare medical insurance, whether by automatic notification or through an initial, special, or general enrollment period, a person is covered by guarantees if both of the following are true. The person is age 65 or older and is enrolled in Medicare for the first time based on age rather than disability. And if the person applies for Medigap insurance within 6 months of enrollment in Medicare Insurance Part B. But note that even when a person buys a Medigap policy in this open enrollment period, the policy may still exclude coverage for pre-existing conditions during the first 6 months the policy is in effect. Pre-existing conditions are conditions that were either diagnosed or treated during the 6-month period before the Medigap policy became effective.
And what about those that are on Medicaid? Does a Medicaid recipient need Medigap insurance?
The low-income people who are eligible for Medicaid usually do not need an additional insurance. Medicaid pays for certain health care benefits beyond those covered by Medicare, such as long-term care, nursing home care. In many cases, it is illegal to sell a Medigap policy to someone who is receiving Medicaid. If a person purchases Medigap insurance and later becomes eligible for Medicaid, he can ask that the Medigap insurance benefits and premiums be suspended for up to 2 years while he is covered by Medicaid. If the person becomes ineligible for Medicaid benefits during the 2 years, the Medigap policy is automatically reinstated, provided the person gives proper notice and begins paying premiums again.
Good information right there. So what are guaranteed issue rights?
Guaranteed issue rights are rights you have in certain situations when insurance companies must offer you certain Medigap policies when you aren't in your Medigap open enrollment period. In these situations, an insurance company must sell you a Medigap policy cover all your pre-existing health conditions, and they cannot charge you more for a Medigap policy, regardless of past or present health problems.
It's good to know. And what about other people that may have another question? If they can buy a Medigap policy if they end up losing their healthcare coverage.
Yes, you may be able to buy a Medigap policy because you may have been guaranteed issue right to Medigap policy. Make sure you keep these. A copy of any letter, notice, email, and/or claims denial that have your name on them as proof of your coverage being terminated. The postmarked envelopes, these papers come in as proof of when it was mailed. You may need to send a copy of some or all of these papers with your Medigap application to prove you have a guaranteed issue right. If you have a Medicare Advantage plan, like an HMO or a PPO, but you're returning to original Medicare, you can apply for a Medigap policy before your coverage ends. The Medigap insurer can sell it to you as long as you're leaving the Medicare Advantage plan. Ask that the new policy takes effect when your Medicare Advantage enrollment ends, so you'll have continuous health coverage.
Well, thank you, Carolyn, for
You're welcome.
answering all this tough questions regarding Medigap. And we're here, we're open, so please give us a call at 1-800-963-5337. And if you have additional questions, whether they're Medigap, anything related to Medicare, we can connect you to one of our amazing SHINE volunteers. Thank you for your time today, Carolyn, and have a good one.
Thank you, Amy.